Welcome, this is Dr. Bertalan, the medical futurist, and it's so great to be part of the Reshaping Australia dialogue series, and especially many thanks to the Australian Financial Review and Microsoft Australia for inviting me today to talk about how to be the hero who saves healthcare. Normally, we would meet in a conference hall somewhere around the world, but well, welcome home. I've got good coffee for you, and I hope that we can have a vibrant discussion after this short talk. This pandemic has brought unprecedented changes to our lives, and I'm sure that all of us want to go back to normal, but I'm not sure if that normal is going to be the same. It has been inspiring seeing all those heroes in the front line, but maybe it's time to talk about how we all can become heroes who save healthcare. I don't know about you, but I have loved heroes all my life. I loved watching them because heroes are people who seem to be like that they are in charge, they are in control, they know what happens next, and it's an amazing feeling to watch them doing their job. So let's check out what defines a hero. First of all, an hero is honest like Captain America, the comic book hero who fought evil across dimensions and generations to save the world. And still he could demonstrate exemplary human values, and he has always been honest to his core. A hero also has to have empathy, and who is a better example for that than Prometheus, the mythological hero, who brought fire to people despite the orders of Zeus, and for that he was tied to a rock and an eagle ate his liver every single day. But he wanted to bring us fire and knowledge this way to help us keep on improving as humanity. He had real empathy. A hero is a role model. Just look at Rosa Parks, the mother of the civil rights movement and the freedom movement, because of her role in the Montgomery bus boycott when she refused to sit in the colored section of the bus. She was a real-life hero. And just one more feature here. A hero must be optimistic about the future, and I think the best example about this is Super Mario, the video game hero, who also fought evil and who went through obstacles in the Mushroom Kingdom because he wanted to rescue the kidnapped Princess Peach. He was more optimistic than any of us ever. I think these features define a hero, and how amazing it would be, I always wonder about that in the most vulnerable state of our lives, when we have a symptom, we have a diagnosis, a medical condition, we could feel like heroes. We would feel like we are in charge, we are in control, we know what happens next. How amazing it would be. Feeling like someone like Iron Man, being a real human person who is aided by advanced technology such as artificial intelligence and exoskeletons and health sensors and all these. But wait a minute, Iron Man exists. I mean, there are technologies that seem like just came out of science fiction and are being used in everyday healthcare worldwide. Just look at a few real-life examples from Australia. You know, what if we could use medical drones to deliver supplies to locations which couldn't be reached otherwise with traditional methods? There is a company called Swoop Aero in Australia that has been delivering supplies in Africa, and now they want to deliver COVID-19 test kits and supplies in Australia. So medical drones now can deliver real-life supplies to rural locations. What if we could use an artificial intelligence-aided chatbot to help patients and physicians find the information they need? Well, the Department of Health in Australia launched SAM, the health chatbot, on their website. Patients and physicians can go on for free, they can ask questions, they can answer a few questions they get from the chatbot, and then the chatbot will recommend them reliable health resources. This is incredible. What if I could use my DNA information and make sure that I only get medications that I would not have a side effect for? I used a service in Australia called My DNA that sequenced my DNA, and they told me what kind of medications I would have a side effect for. They gave me a list of 130 medications which of course I brought to my primary care physician. And now we know which medications I should never get because I would have side effects, or I would get hospitalized because simply I'm sensitive to certain medications and I digest, metabolize others a bit more fast than other patients. It's not my fault, it's not my physician's fault. We are that different genetically. These things are in use in practice today, only in Australia. This is mind-blowing. But I don't think that you all feel that science fiction is part of healthcare, that when you go into healthcare, you meet your medical professional, it feels like you just popped out of science fiction. And that's what we do research about at the Medical Futurist Institute. We are trying to find out why we don't feel that advanced technologies are part of healthcare. We think there are three major reasons for that. And the first major reason is that healthcare as a system was not designed to be open to innovations that much, to be honest. And there are four sub-reasons for that. The first is doctor shortage. 5 million healthcare workers are missing from healthcare worldwide, according to the WHO. 5 million. It means we will never train as many as we need. So all of us will always live in a world with major doctor shortages. It's going to be a luxury to be able to meet a physician right away with any health issue or symptom that you have. The second sub-reason is a lack of trust issue. Modern healthcare doesn't have time for patients, and the only thing alternative treatments have is time. Nothing else now we know based on studies. Therefore, 1/3 of patients turn to alternative treatments because they don't get the attention, the empathy, the time that they would need from their medical professionals. The third sub-reason here is a lack of money issue. If you live in a country with socialized medicine, you can get access to care quite fast, but there is not enough financials for implementing real innovations into care. If you live in a country with a private insurance system, then you can get all the innovations that you want if you are wealthy enough. You get my point here. If you are wealthy enough, you can live longer, you can have biological advantages. Even today we know that based on studies that the 1% wealthiest Americans already live 10 years longer than the bottom 1%. And this is just about the access to care, nothing else. So imagine what happens when the access to 3D bioprinting tissues and telemedicine and health sensors and artificial intelligence can come into the picture. This is going to create an ethical nightmare scenario where you can live longer and you can be healthier than I can because you have more money than I do. This is something we cannot allow happening in healthcare. That's what we are all fighting against. But because of these sub-reasons, healthcare was not designed to be welcoming, to be open to innovations. Even if it were, then comes the second reason why we don't see these advanced technologies in healthcare. And it's about the notion that we in healthcare, including patients, medical professionals, even policymakers, we are slow at adopting these changes. That's it. Let's be honest about that. But if you look at certain technologies, we understand that eventually we adopt these technologies, but it takes a lot of time. Look at a stethoscope. This is how we listened to cardiac and lung sounds 200 years ago. Physicians had to put their ears to the back or chest of patients. And then the French physician Laennec came up with a gadget idea, the hollow wooden tube that would augment the sound because he saw his kids playing with it. And it was brilliant. It's a very simple, very cheap method for improving their job. But it took him 30 years to get this message across to medical associations worldwide because physicians didn't want to use a gadget while practicing the art of medicine. Today, if this thing is around your neck, you must be a medical professional. That's how it has become the symbol of being a physician. The issue I'm trying to describe with this example is that before we had 30 years for one gadget innovation, a hollow wooden tube, and now there are 30 innovations coming out every single day. Digital stethoscopes, portable ultrasound systems, artificial intelligence-based diagnostics, and so on. And it's really hard to prepare for all these, if not impossible. And medical curriculums worldwide just don't prepare future physicians for these things and for assessing the quality of these things. Therefore, we are slow at adopting these advanced technologies. Even if we were if we could be faster adopting these technologies, then comes the third reason why we don't see these in healthcare. And that's, I think, quite obvious. It's easy to be afraid of the unknown. And the unknown here is artificial intelligence. When in the 1990s, the IBM supercomputer named Watson could beat the best chess player at that time, Garry Kasparov, we knew that something big was about to happen. Even that time, that was not artificial intelligence, it was just a big supercomputer that could calculate so many moves in chess and make good decisions on the go. But we knew that artificial intelligence will have a special place in performing tasks where we people think that we are the best at those. Well, I'm not so sure about that anymore. And when 2 years ago, the world's best Go player, another board game originating from China, on the right, Lee Sedol, the 18 times Go champion, was beaten by the algorithm made by a Google company, well, it seemed like this is happening. That algorithm learned how to play Go by playing millions of games against itself in a few hours, without any human help. And that game is very different from chess. Chess is more or less computable. Go is not. In Go, there are more potential board positions than the number of atoms in the universe. So if you have a computer large enough like a planet, it would still not be enough to calculate all the potential moves. So what you need is creativity, intuition, real-life human skills. And that's what the algorithm could demonstrate. So, keeping this in mind, this algorithm has zero IQ, but it's the best Go player in the world. The best chess player in the world today is an algorithm named Lila. We know these things, and these can only perform brilliantly at a single task. But obviously, they will get better. There will be repetitive tasks where we will not be able to compete. And maybe there are tasks where we shouldn't compete. We should dedicate our time and precious attention to more important things, to care for patients, to have real-life conversations, not doing data-based repetitive tasks. So that's why it's so easy to be afraid of the unknown. But because of these three major reasons, we think that what's going on in healthcare in the 21st century is not a technological revolution. It's a cultural transformation. Because the way the hierarchy of a doctor-patient relationship is transforming into an equal-level partnership, the way passive patients are transforming into proactive, empowered patients, the way burnt-out physicians are transforming into e-physicians, well, these things are much more important than which microchip or technology comes out next year. So this is firmly a cultural transformation. If I had to summarize what digital health leads to, I think it's making patients the point of care. This is the ultimate goal of all these digital health technologies. But these only happen, we can only use these technologies if we embrace this cultural transformation, if we facilitate how physicians and patients can form those equal-level partnerships while being aided by these technologies. I think summarizing this up, with this cultural transformation in mind, we have to address that Australia is in a unique position. It has rural communities, it has a unique geographical situation, and it has a digital health policy. Not many countries in the world, like 5 or 6, only have digital health policies specifically aimed at using digital health technologies. So I think Australia has the chance and the opportunity to take the right leap into this new world to finally bring healthcare into the 21st century. And we can all, you can all, help make this happen by becoming those heroes who save healthcare. You know, we discussed this before. Heroes have these definitive features like empathy. What is the best way to get empathy in this? Well, through patient design. Patient design means that we involve patients on the highest level of decision making. Just look at this Dutch example. When they wanted to design a new facility for the whole hospital building, they invited their chronic patients to have their voices heard. Let's see what those patients would love to see in practice. Patients asked for round tables, not the traditional work desks, because around those round tables, They could sit next to their partner, their medical professional. They could look at the same data at the same time. And when they have to be examined, then they walk to the clinic. Within the blue line, in the same room, it's called a clinic. There, a physician can examine professionally a patient. And when they are done, they go back to being equal partners. Patients love this space because they feel that they are members of the medical team. They can get engaged, they can contribute to their care. It's really motivating. Physicians love this space because it leads to less burnout, because these patients come up with better questions. They are more focused, their compliance is better, they can act as real-life partners, sharing responsibility. And if you are wondering about the cost, I asked too. That's an IKEA table and blue duct tape on the floor. That's the cost of patient design. So these days, we are pushing every healthcare organization, every pharma company, and every government to appoint an empowered patient advisory board on the highest level of decision making. Not just asking them what they think, but implementing their ideas and making decisions based on those. This is what everyone needs to do in healthcare. And this is the first step to becoming a hero, having empathy through patient design. The second value or feature we must have here is being honest. And by this I mean being curious about our own health and disease management. There are technologies through which we can obtain data we couldn't do before. Plus, by doing this, you gradually understand the patient of the future, the consumer of the future, their needs, their requests, and the way they want to live their lives to have a better chance for a longer and healthier life. Like myself, I've been tracking my sleep for many years. I use a smart sleep alarm, so I wake up in light sleep, not deep sleep, which means I wake up feeling energized and not exhausted. That's a pretty big difference. I've been using a fitness tracker to check on myself, how many steps I take a day to keep myself physically active, exercising 30 minutes on average every day. I would never do that by myself, only by getting the inspiration from data through my sensor. You can now measure stress levels, you can use EEG sensors to learn how to meditate properly, and then stop meditating with it and try to reach mindfulness through traditional methods. We can now have genetic tests, like I've had many, so I learned what kind of risks I have for certain medical conditions, what kind of side effects I would have for medication like I described before. And with this information in mind, with my primary care professional and my genetic counselor, we designed a preventive plan to make sure I do everything I can to have a chance for a long and healthy life. I even had my microbiome sequenced, so I know what kind of bacteria live in my digestive system, telling me what kind of diet and lifestyle I should have based on these details. Any patient can do any of these, and you can imagine it's gonna be more and more massive in the near future. But today, because of some cheap and simple technologies, we can finally be curious and honest about our own health and disease management, not waiting for someone else to make these decisions above our head. And the third feature we need to become a hero is some sort of techno-optimism. I don't expect you to become a geek like me, but I do expect you to embrace this feeling that with some technologies, with embracing the cultural transformation of care, things can get better. Just look at how medical professionals for 2000 years have been translating data, answers coming from patients, the things they could measure about those patients into actionable steps, diagnosis, treatments, monitoring, and so on. I think this will go on, this method will be the same, but the tool set is going to be vastly different. Artificial intelligence, advanced genomic data, the combinations of these, it's going to be a new world for medical professionals, plus a new world of opportunities to provide better care for their patients. But this gives, at least to me, it provides optimism that things can get better, because the real-life human values, the empathy, the attention will always be there by using other technologies. Like, this is what we asked the world's most empowered patients and physicians. We interviewed all of them in 2 studies, asking about their future vision of healthcare. And they didn't ask for microchips and artificial intelligence. These people asked for, and they are the most advanced e-patients and e-physicians in the world, they ask for empathy, attention, and time. To have time with each other, that they can have real-life human conversations. That's why at the Medical Futurist we believe that we need to remove health IT, the interfaces, the old technologies from the doctor-patient relationship, and allowing them to have real-life conversations with empathy, attention, and time while being aided and supported by advanced technologies, chatbots, artificial narrow intelligence, health sensors, portable diagnostic devices, whatever you need to help them work together by being aided by these technologies. And by following these 3 simple steps, gradually you become the role model who can save healthcare. You become a role model who talk about these issues, who raise these issues with your medical professionals or with your peers, who raise issues about privacy and want to protect your privacy, who know about the ethical challenges, and who doesn't want to have a world where we have an ethical nightmare scenario. Knowledgeable, considerate people who want a better future for themselves and for their loved ones. I think this pandemic has clearly showed us that the world, especially today, needs real-life heroes. And maybe it's time to find out for yourself that maybe following these simple steps, how you can become the hero who saves healthcare. And this way, patients or medical professionals, policymakers or researchers, all of us can do our job to make sure that we create a better world. And the normal that we are going back to after the pandemic is over, because once it will be over, is going to be different, but even better than what we had before. Thank you so much for listening to my talk. I wish you strength for this upcoming journey of ours, and I cannot wait to join you for the live Q&A. Thank you so much.